Former Baywatch babe Nicole Eggert, one of the stars of No Relation, one of the stars of ABC's hit reality show Splash, is still recovering after taking a tumble off one of the high dives during a warm-up, and she suffered some pretty serious bruising. She is going to be all right, however, but man, she got banged up pretty good.
I know, that was scary, but how do you know if it's a bruise or if it's something you really need to see a doctor about? In this week's edition of Doc Hollywood, I sit down with Dr. Carson Harris, an emergency medicine physician at Regents Hospital, to get the dish on that and other celebrity health news. Everybody, I am here with Dr. Carson Harris, and Dr. Harris is an emergency medicine physician at Regents Hospital. Nice to see you, Dr. Harris.
Good to be here.
We're going to talk a little bit about Dwayne "The Rock" Johnson, big movie star, and he underwent abdominal surgery last week. He tweeted, "Saw my doctor who had to push my intestines back through the tear in my abdomen," and then he later tweeted that his surgery was a success and said the doctor repaired 3 hernia tears. So, Dr. Harris, what's a hernia tear? How do you fix it?
Well, a hernia tear would be something like an opening or a tear in the lining of the abdomen or in the abdominal wall. And then, of course, the hernia is just intestines that come out through that tear, and then you have to push them back in.
Wow, it can be pretty painful.
It can be painful, especially if it gets stuck outside of the tear.
So The Rock, his hernias were apparently caused because he professionally wrestled a 300-pound man. That's not something most of us are doing on a daily basis, hopefully, but what are some maybe more common causes of a hernia?
It's usually if someone has a weakness in the lining of their stomach or in the lining of their abdomen, and through that weakness and increased pressure inside the abdomen, that can push the intestines out through that weakness. The lining in the abdomen actually tends to weaken a little bit more the older we get. So we do tend to see more hernias in older patients than we do in younger patients.
Is this something like, having abs of steel can prevent, or no?
Probably not. A lot of people are actually born with a weakened area in their abdomen, so they may be more prone to have hernias later on, especially if they're doing a lot of strenuous activity, lifting, straining, that kind of thing.
Nicole Eggert on the show Splash, she had to go to the hospital after a very scary dive. She was doing multiple flips and then landed really hard on her back, and she tweeted out photos of her bruises, which looked really bad, but doctors eventually determined that she didn't have any internal injuries. So when you're looking at somebody who's really bruised up, how do you figure out what's going on inside?
Basically, everything starts with a physical examination and figuring out what the mechanism of injury was. So we start with the examination, and then from that point on, we go to other tests, such as like an X-ray or ultrasound or even a CAT scan in many cases.
Do you ever have situations where people are pretty bruised up and think, oh, it's just a bruise, I'm fine, but there actually is something going on inside?
Oh, yes, yeah.
When do you know that you need to go in and see the doctor?
If things are not getting better, or you feel that you're not improving as fast as you normally would, then you should go in and at least see either an urgent care physician or come to the emergency department.
So speaking of the ER and urgent care, how do you know which one you should go to?
Urgent care, typically, if it's something that's been going on, sometimes a cough or even mild abdominal pain that is associated with certain foods, you may want to go to urgent care first. But if you typically have something that is more in the chest or severe pain in the abdomen, ideally it's good to start with the emergency department.
Thanks so much for your time, Dr. Harris.
Thank you.
And you can vote for next week's Doc Hollywood topic, and you could win a subscription to People magazine so you can be up to date on all the celebrity gossip. To enter, text Doc1, Doc2, or Doc3 to 42379 for the topic you want to hear about next week. And you can choose from Eva Longoria's post-divorce weight loss, Clint Eastwood's wife's struggles with depression and anxiety, or will.i.am from the Black Eyed Peas opening up about his ADHD. Lots of topics.
All thanks to Health Partners Clinics and Regents Hospital for sponsoring the show. And remember to check with your physician if you have a health concern.
Absolutely.
I have a